Greetings, everyone, and thank you for joining me on this episode. I am excited. Of course, I say that all the time, but I really am. I have a guest joining me. So, on this podcast, we cover all the things, all the topics, and answer your questions at this intersection of public health and entrepreneurship. And I'm your host, Dr. Huntley. I'm a public health entrepreneur with over 20 years of experience in both healthcare and public health. And I've supported a lot of entrepreneurs along the way. My guest on this episode is Harvey Kennedy-Pitt, and we go back a lot of years. I'm really excited for you to get to meet him and to hear about his entrepreneurial journey. And yeah, so Harvey, welcome to the podcast. How are you?
Yeah, I'm fine. Thank you so much for having me. This is always a special moment.
Oh, I feel the same way. So let's start at the top. Why don't you tell everyone a little bit about yourself, your business, and of course, the name of your business and what you do?
Yeah, so my name's Harvey Kennedy-Pitt. I am an educator as a scientist. I've also been an educator, speaking, teaching in schools, speaking in schools, just, basic hard sciences, biology, chemistry, physics. People go, really? Oh my goodness. Yeah, that's true. Of course, have worked in public health as well, worked for the NHS. That's the National Health Service here in the UK. I've worked at the community level. I'm also a community organisation founder, so I ran a charity for about 5 years, and now also a third-time founder. So I call myself a multi-founder now, because I this is my third endeavour, which is Unstuckk. And Unstuckk is essentially a health equity consultancy that's really focused around helping people and their organizations to build capacity through adaptation using public health. So to break that down, we talk about the people. Those might be leaders. Those could be mid-level leaders or senior leaders, or leaders who are just in charge of a program or a project, but they're really trying to work with their organizations to build capacity. Now that might mean different things for different people. Capacity, is it time? Is it money? It's figuring out what they mean by capacity and addressing that. And of course, people don't want to reinvent the wheel. They don't want to start from scratch. So I use the word adaptation because actually there's so many things that we've already worked on. There's things that are already in existence. And sometimes we can look at those things and we can just change them ever so slightly, and then sort of be back on the road again. And of course, the most important thing is using public health. And so it's raising an awareness of what public health is, how it can be utilized, and applying some of the key principles that we use to try and be transformational in our approach to health equity.
Wonderful. I love to hear you explain that. And every time I kind of have a different feeling. And now what's really going through my mind, because we do support a lot of BIPOC organizations and we really niche down through our own consultancy and the challenges that exist are different from organization to organization, population to population. And what stood out the most in this time hearing you say this was the adaptation, because you're right, there are often so many things that are existing already that we could just tweak and polish a bit, make some adjustments and adapt, and then it's ready to go instead of starting from ground zero.
Yeah,
So
yeah. Yeah. And I use that because people get scared when you say we're going to
mhm.
come in and do something. Oh, he's going to make us start again from scratch. That is absolutely not my approach because I think we all bring something that's already partially or fully formed there that just needs to be adapted.
Yeah, that's wonderful. And also, as I was listening to you, I kind of took a run back down memory lane, and multi-founder. Yes, I remember when the very first, right before it launched the very first time, watching you through so many changes on this journey, and we've met in person a few times. You've come here to the U.S. I've been over there in Manchester, and we've just had a great relationship of just being on this journey, supporting one another, and hashing out some of the nuances. But something that consistently remains is the challenges that are. We talk about how it's different here in the U.S. compared to the U.K. And you do have, you did spend some, you have some time here in the United States, so you are familiar from firsthand experience what it's like here. But also, um, I really appreciate your perspective. So would you mind just talking a little bit about what public health is like, maybe the view, the lens? I know you listen to my other podcast, Public Health Epidemiology Conversations. You've been listening to that one for years. You're very familiar with how we speak about the challenges, and especially from the perspective of equity here in the US. How is public health different? What are some of the things that stand out for you from the UK perspective?
Yeah, that's actually a really good point when you're talking about the United States, because I think in terms of public health in the States, they speak a lot about indigenous people, or people who might have even been sort of marginalized or racialized as a result of globalization, colonialism, etc. Here in the UK, this is historically seen as a very sort of Anglo or sort of European country, where there doesn't really encourage a conversation around indigenous groups, or who has ownership of something, or what their value might be, because I think that it's more sort of asset based. People who came here to do, people who came here to study, people who came here to do something. So that indigenous piece is kind of missing. Whereas, of course, in the United States, you have sort of Native American Indians, you have all these tribes that you've worked with, so much learning that can happen as a result of working with these groups. And of course, utilizing those learnings to apply to maybe other pieces of work that might be targeted at sort of other BIPOC communities. And so there's that piece of history that we sort of don't have here in the UK. And whilst I have lived in the United States, I've studied in the US as well. I think that from a professional perspective, it's a very different landscape in terms of what you get to put into practice. You'll also know that I did my MPH. I was lucky enough to do my MPH in South Korea, actually. So I didn't even do my MPH sort of in the US. And so that application of those public health principles, the groups and populations that we speak about, and certainly the attitude, I'll sort of use that word quite liberally, the attitude toward sort of challenge or change, or sort of constructive criticism will be received differently in the US than it will in the UK. I know you've got examples of Florida's governor at the moment, who sort of big decisions are being made that are sort of silencing a lot of the voices that we rely on in public health to better understand their needs. But also, that sort of attitude is creeping across the US and other places now as well. Here in the UK, we definitely operate on a system of subtlety. Sometimes you don't even realize that something has been shut down until it's too late. Sometimes you don't realize that a conversation has been curtailed and redirected, because it has been done so subtly. And I think it's just the English way. And so just the way in which we do things here in the UK is noticeably different. The way that we practice public health is very contextual. And while the principles still remain, how those present themselves, whether in writing or in conversation or in interventions that are designed and implemented, you have to kind of look with a squinting eye just to make sure you don't miss them.
Yeah, that subtlety part still gets me.
Yeah, yeah, true, right? Yeah,
Right. Yeah. Yeah. I was able to, yeah, it's definitely true. It's just a very, it's obvious difference.
yes,
But thank you for, really going into that. I think that, it's just important to express that. If
Mhm.
you're always thinking just from the perspective of your own country, then I think there's a big missed lesson and opportunity to really to see a more holistic view. I think that it's also important because this podcast, as young as it is, it's already being listened to in multiple different countries. So I think for our listeners who are not US based, they will
Mhm.
appreciate that even
Yeah,
more. So yeah,
yeah.
thank you for that. Okay, let me watch my notes because you and I can digress
So,
easily. Okay, so my next question for you, I love asking this question. Um, when did you first become interested in public health as a career?
So, as a career, I think it's after my my first publication. So I had finished my MPH. Strangely enough, I didn't even think I could go into public health having completed an MPH. That's how late it can happen. In that, sort of public health came to me, so I decided to do the course. I was in South Korea teaching English on a gap year, and sort of took a moment to chat to a friend who had already looked at this MPH course. I thought to myself, what is this MPH course that's being offered in South Korea? Like, this can't be a real course. And it was, it actually was a real course. And upon investigation, ended up in the field. But in terms of practicing, it was when I had published sort of my first article and then realized there's work to do here. So how do people deliver this work, how do the people do this thing, that I've written about, and so I ended up in the community immediately. So in South Korea, after I'd finished my MPH, I took a postgraduate year to do research as well, which included translation of UNAIDS resources. It also involved going to local venues, including clubs, because my background is in sexual health. So going to clubs, doing lots of condom and lube distribution, mixing that with performance art, making it creative, just trying to draw people into the conversation, utilizing resources that were in multiple languages to try and keep some of the foreign population, but also the integrated expat community in South Korea aware of their options. So that's what I do. Long answer, long answer. Yeah, but
Yeah.
it's nothing straightforward. Yeah.
Yeah, I think that that's I hear that often. We very few times I hear someone who says, "Oh, yes, I knew that I wanted to do public health and I did this, this and that and went on this straight line to
Mm.
into the field." It's usually a journey and it's
Yeah.
got lots of curves. So I love hearing about the journey, and I like for other people to hear. From where I sit, I get to hear these unique stories all the time. So I love this podcasting to be able to share that. Okay, so here's a really a good question that I think will help a lot of people who are listening, because a lot of us are multi-talented. We could start a business and bring any number of skill sets. There's really no wrong way to do this. There's a lot of different things we could do really, really well. But how did any of your previous experiences help prepare you for this journey of entrepreneurship?
This is a really good question. So, as I mentioned earlier on, so a multi-founder. This wasn't my first rodeo. Prior to this, I had founded a charity which was sort of aimed at supporting and advocating for racially and sexually minoritized individuals here in the UK, specifically around sexual health, mental health, reproductive health, and chronic conditions management. And so that was, my first public health endeavor. But even before then, I was a founder of something called Goliath Music, which was when I was based in London. And it was really about bringing music education on a number of different types of instruments to some of the less exposed, I guess, communities in London. So all of who were from non-English or non-white backgrounds. And so I hate to say the word non-white, but I think what I mean there is people from racialized backgrounds or sort of racialized experiences who would never have seen a violin, who have never have seen a piano, who have never have seen performances, recitals. And so all of the experiences in organizing, groups of people from all across different areas, sort of managing generally geographically dispersed teams. That was really sort of brought into this new endeavor of mine, which is about just over 2 years old now, Unstuckk. And that's connecting, engaging communities, keeping track of what you're doing, articulating what you mean, ensuring that it's understood, bringing stakeholders on the journey. I've been doing that for quite some time. So those are the skills that I think come to mind.
Yeah, I think that's. I love to hear that too, because sometimes we think, I'm not sure. Sometimes people think they've got to take everything together and put it into one business and tie it all up with a bow, and that's impossible.
Not to,
It's some of those key skills that are transferable and needed. You can sift through and pick the thing that resonates the most and feels the easiest, in the sense of, that work comes very second nature to you. Um, High value, but low stress. That goes a long way, right? Okay, so this part is kind of with two questions, but we're going to talk about what you like the most and what you like the least. So, on the first question, what do you like most about public health entrepreneurship?
So variety is still the spice of life. So I will say that you never know what you might come across, which opportunity might land on your plate. People reach out randomly via email, people you've never heard of, and they say, I've been sent your direction because I heard you've got skills in X and I've been trying to do Y. So let's Z or Z,
Yeah,
let's get together and try to figure out how we can collaborate and work together. So this has taken me all over the place, so it's taken me,
yeah,
you're frequently sort of hopping onto the continent. I was in sort of running around in Paris and Amsterdam and, Brussels and
yeah,
last year, on very different ventures because I was called upon to contribute to things. And so I really like the variety that you never know what you're going to get. You never know what you're going to be asked to do. It will always be relevant to what you do And sometimes it might open up a new conversation that you never thought that you could do that, but you're drawing, oh yeah, actually, yeah, I can do that through my business. So that's what I kind of like the most: the variety, the surprise, the let's open our inbox and see what we see today.
Yes, I love that too. When you were describing that, I immediately thought about we had lunch at Piccadilly Station,
We did.
and you literally like I flew to the UK. We worked together. We were having lunch, and then you hopped on the train to get to the airport to fly to Amsterdam to deliver
Oh,
a
yes.
workshop. You remember that?
Yes. Yes. And you were very gracious for my sudden disappearance.
I just thought, but that's the beauty of the way that we work and what we get to do. So, like to your point, that's definitely one of the things I like
Yeah.
about this journey as well.
Yes. Yes.
Okay, so in all fairness,
Hmm.
same context. What do you like least about this journey of public health entrepreneurship?
I think what I've learnt that I like the least is somewhat. Some people might say I hate the most. No, I like the least. Is the other side of that, which is when things aren't landing in your inbox and you've actually got to go out there and get them. So that's proposal
Yeah.
writing, it's bid writing, it's reading pages and pages and pages of things that we call over here ITTs, so invitations to quote or invitations to
Mm.
tender. I think you call them RF somethings.
RFPs, yes.
RFPs,
Yeah.
so sort of looking at the opportunity, triangulating your skills, sourcing the people if it requires more than one person, and doing pages and pages and pages of work. I think I submitted something of 46 pages the other day, because that's how much evidence was required just to show an interest. And then
Right.
hearing back after all that work and kind of saying you've not been selected, and you think, oh, but it was
Uh-huh.
so good. But my proposal was so good. You've got to, take on my offer. So it's getting used to rejection because that's going to happen. Not everyone's going
Yeah.
to like, the approach that you take. And it's sort of getting back on the galloping horse and saying, right, what else is out there? What's next? So it's a nice balance between what we like the most and what we like the least.
Yes, I agree. That's so good.
Yeah.
Um, okay, Harvey, I'm enjoying this conversation and I am thinking about the listener and the whole purpose is for some inspiration and to give these examples. I spend so much time on these episodes coaching, teaching, and bringing on a guest that can bring a fresh perspective and provide some inspiration, which I think you've done beautifully on this in this conversation. So I have one more question for you, and then I can let you go. Um, so, in what ways are you advancing public health through your business or with your business?
Yeah, I think there's no one way to answer that because of that variety. And so, but in terms of advancing public health, it's reminding people that there are other ways to do things. And it's encouraging people within a system that has ever decreasing capacity financially to sort of reach outside of full-time paid roles and work with consultants that actually we are at your disposal. Okay, we are available, we are highly skilled, and we are enthusiastic. We're bringing perspectives that you won't have, so that perspectives diversity, and so consulting is a good thing. Working with consultants is a good thing. It can help to advance whatever you're trying to do. And so I sort of started referring to myself more recently as kind of a health equity strategist because strategy, whether it's the beginning of the strategy, it's the midpoint or the end of that strategy or implementation, the health equity piece is something that is highly underrated. I think people when they're stuck in a place, pun meaning stuck, okay, because unstuck is all about undoing that stagnant
Yeah.
approach to things. They don't even realize that they're just kind of going through a routine. So Unstuck is really about bringing health equity to the front of the conversation and thinking strategically and leaning into implementation. And that's going to look different for different people.
Yeah. Yeah. That's really good. Um, I like that so much because I think from what I hear a lot from, public health leaders, that's a refreshing difference. That is really what I think they're looking for. A lot of these organizations, bigger the organization, especially government agencies, when they really want to pivot and change, the harder it is to do. So we do fit, public health entrepreneurs, consultants, we fit in very unique spaces and we really help navigate and make those changes. So we are
Mm.
sought after right now. And very big ways. So this is a great time to be a public health entrepreneur.
Yeah, yeah. And I
Well,
think it
thank
goes
you
back
so.
to our.
Oh,
Oh, sorry.
no, no, go ahead.
And I think it goes back to sort of my earlier point about the difference between sort of geographically. We're a much smaller country here in the UK, and therefore things tend to be a bit more centralized, whereas things tend to be more devolved in the US because it's such a big, landmass, and they have sort of
Yes.
regional things, and that are happening. And so, with a centralized kind of public health approach here in the UK, I think it's even more important to really emphasize what we offer as consultants here. What makes a consultant up? What do those skills look like? What makes them unique? What makes it such that you can't find those in a big system, in a big ship that's turning? So it's really about ensuring that we can articulate that and use familiar language, but position it in such a way that it's refreshing and attractive to those who need our services, but just don't even know where to find us.
Yes, exactly. Well said. Well, thank you so much, Harvey. I appreciate you taking some time and coming on this podcast and chatting with me. I always enjoy catching up with you. I take whatever time I can get, but always want to keep in touch as well.
Absolutely. I really was excited when I saw your invitation, and I've really enjoyed this conversation as well. So thank you so much for that, for this time.
Awesome.